If your toothbrush bristles look bent or crushed, you aren't cleaning your teeth. You might be hurting them. In this video, we are going to fix your gum health simply by slowing down. Welcome to Senior Bedtime Radio. Many of us were taught that harder means cleaner. It does not. Tonight we will undo that habit. We will cover the soft bristle rule, the gentle 45-degree angle that dentists love, and how to turn brushing into a gum massage. Let's relax your hand and save your smile. Settle in and allow your shoulders to drop. We are focusing on gentle care tonight. Taking care of your teeth should feel like a nightly act of kindness toward your future self, not a scrubbing chore. If you find peace and wisdom in these slow reflections, please consider subscribing. We send out gentle health tips like this every week to help you rest better. Let's start with an important visual check. Go ahead and picture your toothbrush right now. Does it look like it went through a washing machine? Are the bristles splayed out, bending away from the plastic handle? If so, you are pressing too hard. You are using too much force. That might sound like a good thing, like you're doing extra work, but it's the primary cause of an issue we all face as we age: gum recession. Why does hard scrubbing hurt? Think of your gums like the turtleneck collar on a sweater. If you constantly yank and stretch that fabric downward, eventually it frays and pulls away. Your toothbrush is doing the yanking. When you press too hard, the abrasive action of the toothpaste and the stiffness of the bristles actually cut and push the delicate gum tissue down and away from the tooth. This exposes the root, leading to sensitivity and giving harmful bacteria a new place to hide. This is why many seniors struggle with gum health, even when they think they are being diligent brushers. We just have to change the deliqué. We are diligent. The solution starts with the toothbrush itself. This is the first simple, immediate change you can make tonight. You need to put down any brush labeled medium or hard. Throw them away. They are simply too harsh for aging gum tissue. Our gums naturally become thinner and more sensitive over time, especially if we have been brushing incorrectly for decades. The rule is simple: ein man, night neen stead of night neen stead of night neen, or extra soft toothbrush. You must use stead of night neen stead of night neen. Ein neen, night neen, night neen, night neen, night neen. If you are currently using a medium brush, simply swapping to a soft one might feel strange. You might worry that it's not doing enough. Remember this truth: it's not the stiffness of the bristles that cleans your teeth. It's the proper movement and the paste that does the work. Soft bristles are flexible. They can bend and get into the tiny crevices where bacteria hide. Hard bristles just bounce off the smooth surfaces and end up scratching your gums. Make the switch tonight. Look for soft or extra soft on the package label. This is your first step towards saving your gums. The next issue we must address is time. Most of us, when we scrub hard, are trying to get the job done quickly. We might spend 30 seconds vigorously attacking the front 4 teeth and then barely touch the rest. The key to healthy gums is consistency, not speed. The official recommendation is to brush for 2 full minutes, but I want you to reframe that time. Don't think of 2 minutes as a chore. Think of it as a asterisk guided gum massage. 2 minutes is approximately 120 seconds. Divide your mouth into 4 gentle sections: the upper right, the upper left, the lower right, and the lower left. That gives you 30 seconds for each section. 30 seconds is a very long time when you are moving slowly and mindfully. If you are rushing, you miss the crucial gum line. If you are slow, you clean everything. So how do we slow down? We change the motion. Are you currently using a vigorous back and forth sawing motion? Stop that immediately. That motion is abrasive, inefficient, and pushes debris further into the spaces between the teeth. It's what causes the bristles to splay. We need a gentler technique, one with decades of evidence behind it. It is called the BASE method, but we can call it the asterisk gentle wiggle. Let's walk through this gentle wiggle motion together, imagining the toothbrush in your hand. First, hold the brush very lightly. Do not grip it like you are holding a hammer. Hold it like you are holding a fragile, delicate flower. This immediately reduces the pressure you apply. Next, tilt the brush head. This is the most crucial part. You want the bristles to hit the teeth and the gum line at the same time. The perfect angle for this is asterisk 45 degrees. That's halfway between flat against the tooth and pointing straight up at the gum. When you tilt it gently at this 45-degree angle, the tips of those soft bristles can sneak right under the edge of the gum line. This is where plaque hides. This is where the damage begins. Now, instead of sawing, use small, gentle, circular motions. Think of it as a tiny vibration or a wiggle. The movement should be small, maybe the width of one single tooth at a time. Wiggle for a few seconds, then sweep down gently away from the gum. Move on to the next tooth. Wiggle, sweep, wiggle, sweep. This gentle wiggle motion accomplishes 3 important things. 1. It dislodges the hidden plaque, right where the gum meets the tooth. 2. It massages the gum, which is associated with improved circulation and healing. 3. Because you are moving so slowly, you naturally spend more time in each section of your mouth. It feels calming, and it works. If you struggle with arthritis or dexterity, moving a manual toothbrush in those tiny circles might be frustrating. This is a common and very valid concern as we age. But do not abandon your cleaning ritual because of it. There is a simple, effective adaptation here. Damjas Mimo invest in a quality electric toothbrush with a pressure sensor. Asterisk. A good electric toothbrush is not cheating. It's an essential tool for maintaining dignity and independence in your self-care routine. The great benefit of these modern brushes is that they do the wiggle or the oscillation for you. You just need to gently guide it along the teeth. And crucially, many quality electric brushes have a pressure sensor. If you press too hard, the brush will flash a light or slow down the motor, giving you immediate physical feedback that you are hurting your gums. This can retrain your hand to use a softer touch faster than any video can. If you are looking for a simple change that makes a huge difference in your nightly comfort, this is the one. A simple sonic toothbrush is an investment in your long-term gum health. Let's pause and consider why we care about this so much. It's not just about keeping your teeth in your mouth. Your mouth is intrinsically connected to the rest of your body, and managing gum inflammation is an act of total body preservation. When you have gum disease, the bacteria in your mouth cause chronic low-level inflammation. that inflammation doesn't always stay contained. It is associated with systemic issues throughout the body. Studies have shown a strong link between poor gum health and cardiovascular health. Some scientists are even exploring the link between certain bacteria from the mouth and neurological health, including a potential association with Alzheimer's disease. When you care gently for your gums, you are actively managing inflammation at its source. You are supporting your heart health. You are doing a simple, powerful thing to support your overall longevity. This nightly ritual is more than just cleaning. It's a form of preventative self-care that provides great peace of mind. Now that we have established the how, soft bristles, 45 degrees, gentle wiggle, let's talk about the missing pieces that often undo our good work. The first crucial component is the asterisk neural line itself. Even with perfect technique, many seniors deal with some degree of gum recession. When the gums pull back, it leaves tiny V-shaped gaps between the teeth. Your toothbrush cannot effectively clean these gaps. That's why traditional flossing is so important. But we already acknowledged that string flossing can be painful, difficult, or impossible due to arthritis. If you cannot use string floss, you must adopt an alternative cleaning tool. Do not skip this step. Skipping this step is like washing your hands but leaving your fingertips dirty. The best alternatives are interdental brushes or a water flosser. An interdental brush looks like a tiny pipe cleaner. They come in many sizes. Find the size that fits snugly, but not painfully, in the gap between your teeth. They are simple to use. Just slide in, slide out. They are excellent for targeting those receding gaps. The water flosser offers another soothing alternative. Instead of friction, it uses a gentle, pulsating stream of water to flush bacteria out from under the gum line and between the teeth. Many seniors find this massaging action to be much more comfortable than string floss, and it's especially helpful if you have crowns, bridges, or implants. It's a wonderful tool for gentle care. Another common factor contributing to poor gum health in older adults is asterisk non-medication-induced dry mouth, asterisk non-EBS. Remember, saliva is your mouth's natural defense. It washes away food particles, neutralizes acids, and contains antibodies that fight bacteria. If your mouth is chronically dry, you lose this natural protection, and gum disease accelerates. If you take medications for blood pressure, allergies, or pain, and many seniors do, you likely deal with dry mouth. Brushing aggressively when your mouth is already dry is doubly damaging. If you struggle with dryness, here are 2 immediate, gentle takeaways. First, brush right before bed and rinse thoroughly afterward. Use only a small, pea-sized amount of low-abrasion toothpaste. Second, try to avoid alcohol-based mouthwashes. Scratch. While that sharp, minty sting might feel clean, the alcohol actually dries out your mouth further, making the problem worse. Instead, look for gentle, fluoride-containing rinses, specifically formulated to help with dryness. These often have a lubricating feel. The final element of our gentle ritual is simply allowing enough time for the fluoride to work. Fluoride is nature's armor for your teeth. It helps remineralize the enamel and protect the root surfaces that are often exposed due to recession. After you have completed your slow 2-minute gentle wiggle routine and you've used your water flosser or interdental brush, avoid rinsing aggressively with water. Many people rinse multiple times to get rid of the residual paste flavor, but when you do that, you are washing away the concentrated fluoride. Instead, just spit out the excess foam and let the residue sit gently on your teeth while you climb into bed. It sounds simple, but letting that protection remain on the teeth overnight makes a significant difference in preventing decay, especially root decay associated with receding gums. Let's review our gentle steps. Tonight, you will put your old hard brush away and swap it for a soft one. You will hold it lightly, like a flower. You will tilt it gently to 45 degrees so it touches both the tooth and the gum line. And you will use a small, slow, gentle wiggle motion for 2 full minutes. This is a deliberate, soothing, and effective routine. It's a conscious act of slowing down, which is good for your teeth and excellent for your nervous system as you prepare for sleep. Do not worry if you feel like you haven't scrubbed hard enough. That aggressive feeling is based on an old habit that harms you. The soft touch is the kindest and most effective way to care for your mouth tonight and every night. Take a deep breath now. Feel the calm of having a simple, effective plan. Gum care does not have to be a source of anxiety or pain. It can be a peaceful 2-minute pause in your evening. If you found peace and clarity in this routine, please tap the like button. It tells us that these gentle health reflections are helpful to you. And subscribe to Senior Bedtime Radio. We are here every week to offer a warm, trusted voice, helping you drift off with dignity, comfort, and peace. Tonight, let the gentle action of your brush soothe your gums and quiet your mind. May your rest be deep and your health be protected. Sweet dreams.